Good morning and good afternoon, and bonjour à toutes et à tous. Today, I want to talk about the importance of keeping up with routine medical appointments, but first I'll start with the latest numbers. There have been 123,873 cases of COVID-19 in Canada, including 9,054 deaths. 89% of people have now recovered. Labs across Canada have tested over 4,970,000 people for COVID-19 to date. And over the past week, an average of over 48,000 people were tested daily, with about 1% testing positive. Based on the most recent 7 days, there have been an average of 380 cases reported daily from across the country. Together, we have worked hard to drive COVID-19 transmission rates down in Canada, and our epidemiologic data indicate that we are keeping spread under manageable control. As we continue to reopen our economic and social spaces, we can expect increases in cases and clusters, as we've seen in recent weeks in jurisdictions across the country. However, we are continually improving our capacity to manage COVID-19 based on our own experience and the experience of other countries. Together, we can limit the size and impact of these resurgences. At the same time, limiting the impact of COVID-19 means taking care of our broader health and well-being. This includes keeping up with routine medical appointments for essential preventive health services like vaccinations, cancer screening tests, dental care, as well as the ongoing management of chronic diseases. Delaying essential medical visits can lead to bigger health problems down the road. Take care of yourself and encourage your loved ones to do the same. Now is the perfect time to catch up on any appointments you may have missed during the initial epidemic wave. Healthcare providers and the colleges and professional bodies that regulate and inform their practices have worked hard to increase the availability and quality of virtual care in Canada over the last several months, and they have put measures and guidance in place to protect you and your loved ones during in-person medical visits. So please contact your healthcare provider to find out how they have adapted their practices so that you can access care safely. Thank you.
Bonjour. Aujourd'hui, j'aimerais vous parler de l'importance de conserver vos rendez-vous médicaux de routine, mais je commencerai par les derniers chiffres. On a signalé 123 873 cas de COVID-19 au Canada, dont 9 054 décès. Des personnes infectées, 89% sont rétablies. À ce jour, des laboratoires partout au pays ont analysé les tests de dépistage de la COVID-19 de plus de 4 970 000 personnes. Au cours de la dernière semaine, nous avons testé en moyenne plus de 48 000 personnes chaque jour, dont environ 1% ont reçu un résultat positif. Sur les 7 derniers jours, il y a eu en moyenne 380 cas signalés quotidiennement dans tout le pays. Ensemble, nous avons travaillé fort pour faire baisser les taux de transmission de la COVID-19 au Canada. Et nos données épidémiologiques indiquent que la propagation demeure à un niveau gérable. Comme nous continuons à rouvrir nos espaces économiques et sociaux, nous pouvons nous attendre à une augmentation du nombre de cas et de groupes de cas, comme on l'a vu ces dernières semaines dans les provinces et les territoires partout au pays. Mais nous améliorons continuellement notre capacité de gérer la COVID-19 en nous fondant sur notre propre expérience et sur celle d'autres pays. Ensemble, nous pouvons limiter l'ampleur et l'incidence de ces réapparitions de la maladie. En même temps, pour limiter l'incidence de la COVID-19, il faut prendre soin de sa santé et de son bien-être en général. Il faut conserver ces rendez-vous médicaux de routine pour les services de santé préventifs essentiels tels que les vaccinations, les tests de dépistage du cancer et les soins dentaires, ainsi que pour le traitement en cours des maladies chroniques. Si nous retardons des visites médicales essentielles, nous risquons d'aggraver notre état de santé. Prenez soin de vous et encouragez vos proches à faire de même. C'est maintenant le moment idéal de reprendre les rendez-vous que vous avez manqué pendant la première vague épidémique. Les fournisseurs de soins de santé, ainsi que les collèges et ordres professionnels qui réglementent et guident leurs pratiques, ont travaillé fort pour accroître la disponibilité et la qualité des soins virtuels au Canada et au cours des derniers mois. De plus, ils ont pris des mesures et établi des directives pour vous protéger, vous et vos proches, lors des visites médicales en personne. Communiquez avec votre fournisseur de soins de santé pour savoir comment il a adapté sa pratique afin que vous puissiez recevoir des soins en toute sécurité. Merci.
Bon après-midi.
Good afternoon.
Aujourd'hui, je vais
Today,
rapidement faire le point
I'll
sur le
quickly
travail qu'on fait
update you
pour
on the
préparer
work
notre
we've
à la
done to
prochaine
prepare
étape
our
de la
country
lutte
for the
avec
next
COVID.
phase of life with COVID.
Comme Dr. Tam l'a déjà dit,
As
il y a
Dr. Tam has
plusieurs
already said,
scénarios que nous modélisions.
we are modeling
Se
several
préparer
scenarios,
une
preparing for the worst,
augmentation des cas
an
lorsque la
increase in
température
cases
va se
when the weather
refroidir
starts getting
et qu'on
colder
passera plus de
and
temps à
we start
l'intérieur
spending more
est
time
essentiel
indoors.
pour
It's
protéger la
essential
santé des
to
Canadiens,
protect the
notre
health of
système de
Canadians
santé.
and our health
On a
system.
fait beaucoup de progrès
A
depuis
lot
le
of progress has been made since the initial outbreak of COVID-19 in our country.
Notre système de
Our
surveillance
surveillance
s'est
system
amélioré.
has
On fait
improved.
plus de recherches
We are doing
et
more
on a
research,
des meilleurs outils
and
pour
we have
comprendre
better
et
tools to
prévenir la
understand
propagation du
and
virus.
prevent the spread of the virus.
Our testing capacity has grown considerably, and we've harnessed the expertise of Canadians to guide us on vaccine development and purchase, immunology research, and many other aspects of this illness. And we continue to have strong collaboration across the country. Yesterday, I spoke with my provincial health minister colleagues. We talked about the ongoing vaccine work, including efforts that we're making to increase biomanufacturing capacity and vaccine deployment here in Canada. We also talked about the need to ensure ongoing support for healthcare and public health workers who have been at the forefront of dealing with this pandemic and continue to make deep personal sacrifices. As the pandemic wears on, we are all committed to making sure that we protect the mental health of everyone, including those working so hard on the front lines of our response in every community. We also reviewed our progress on the procurement of personal protective equipment, and the Prime Minister will have more to share on domestic N95 mask manufacturing later today. Things that continue to worry me and my health minister colleagues include the increase in infections among younger people. Next week, we will have increased targeted communications to young people from the Government of Canada that will speak directly to youth on media channels where they are more likely to see the message. I know that youth care deeply about their communities and families, but they are also drawn to socialize as part of their stage of life. Supporting young people to socialize less or more safely is difficult, but very important if we want to keep the rate of infection low here in Canada. Lastly, I want to remind Canadians that we remain focused on another significant health crisis. Opioid overdoses have increased significantly since the beginning of the pandemic. A lack of safer supply of opioids, a reduction or change of services, and increased isolation have all conspired to present an increased risk of death for people who use opioids. The solutions are complex, but our government has been ensuring that we double down on supports for people who use drugs so they get the compassionate and non-judgmental support they need to stay healthier. Since 2017, supervised consumption sites located across Canada have received almost 2.2 million visits, reversed nearly 17,400 overdoses without a single death at a site, and made approximately 84,400 referrals to health and social services. And we're going to continue to work with communities to ensure safer supplies of opioids in ways that connect people with support that can increase their mental and physical health. It's more important than ever to ensure that communities have the tools they need. That's why we launched a consultation on supervised consumption sites and services. We need to understand better what works and what can be improved. I encourage anyone interested in participating in this consultation to provide feedback on Health Canada's website. COVID-19 has been hard on all of us, but our government will continue to work with communities and Canadians to ensure that we have the tools, supports, and expertise necessary to get through this together. Thank you.
Thank you, Minister. So as usual, we're going to start the question period on the phone. 3 questions on the phone, 3 questions from the room. 1 question, 1 follow-up. Operator, over to you.
Thank you. Merci. Please press star 1 at this time if you have a question. Puis, s'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question is from Theresa Wright from the Canadian Press. Please go ahead.
Thank you very much. Good morning. Dr. Tam, my question is for you. 3 new papers have been published suggesting children may play a greater role in spreading COVID-19 than previously thought. With millions of children returning to school in a matter of weeks, how regularly should children be tested? And should they be tested as regularly, for example, as professional sports teams?
So, safe return to school is, of course, the top topic, if you like, of interest to all Canadians, I'm sure, at this point in time, and public health authorities. So we're learning, as we go along, and every day adds another piece of knowledge, I think, about the role of children in transmission. But I think what we do know still is that children, when they get COVID-19, tends to have a milder illness, and children who are a bit older, say over the age of 10, seems to have the ability to transmit COVID-19 maybe similar to that of older persons. But we still need to really monitor and look at transmission in the younger populations as well. So I think in the weeks to come, it's very important to monitor this careful opening of schools. And obviously all of the public health authorities very much seized with rapid identification of cases and immediate contact tracing and isolation and quarantine procedure. That is the general approach. So I think across the board, the idea is that even people with very mild symptoms shouldn't go to school. There should be some screening approaches that's either done at home or also at the entrance of the school. But testing is mainly focused at the moment on rapid escalation of testing in relation to the identification of a case. We are continuing to explore other types of surveillance for community settings. Some of them would need other testing technologies other than the PCR test that we have with the nasopharyngeal swab, which is quite difficult to sort of implement in the context of these settings. And so the strategy is still to do these rapid case identification and contact tracing, and people are increasing the capacities to do that right now across the board, and the federal government is supporting that. But we're continuing to examine new platforms and technologies that might be able to add to our response and our data going forwards.
Theresa, follow-up?
Yes, thank you. This question is for Dr. Tam, but I'd also like Minister Hajdu to answer as well. The minister mentioned the increase in opioid overdose deaths due to COVID-19. Dr. Bonnie Henry in BC has recommended that the province move urgently to decriminalization because of the crisis. Many other doctors and health professionals agree. Do you believe hard drugs should be decriminalized to address the overdose crisis?
Minister, I believe you're on mute.
I'll jump in and then I'll let Dr. Tam respond as well. I listen, as a person who's worked extensively in the area of drug policy, I don't believe that there's any silver bullet to ending problematic substance use or in fact, dealing with the crisis at hand. It is really a suite of tools that's needed. And in fact, our government has been aggressively providing additional tools to communities that are ready to receive those tools since we were elected in 2015. Ensuring, for example, that harm reduction is available, whether it is through safer supply projects that ensure that people can get prescribed opiate substitutes or opiate drugs that are that reduce their reliance on unsafe and tampered with street opiates is a critical component. Making sure that people have safer consumption sites in communities that want them and can receive them is a part of a strategy. Ensuring diversity of treatment is part of a strategy. And all of this work is in combination with the prevention work that has to happen as well. That is about ensuring less people end up addicted to harmful substances like opiates in the long run. And so I think as much as I hear the calls across the country from many people, it's something worth deliberating about. But certainly there is no silver bullet approach to dealing with problematic substance use in this country or in any other country. It is really making sure that communities have the tools they need and they feel are appropriate to support people who use substances to have healthier lives.
Dr. Tam?
Yeah, so from a public health perspective, and I think I can speak on behalf of many of my colleagues, we know that you cannot arrest your way out of an opioid crisis. It is escalating as we speak. Some of the gains that were made prior to COVID-19 have unfortunately been lost, including statistics coming out of BC, Alberta, and many provinces showing that persons who use substances, who use drugs, are really negatively impacted as we are responding to the COVID-19 pandemic. So that is a public health priority. And I think, as the Minister said, all manner of approaches need to be put to bear in order to deal with this crisis. And I think supporting access to a safer supply of drugs is really critical. And I think that looking at some of the changes in prosecutory guidance is a step in the right direction as well. In the end, it is about recognizing that there's a huge amount of stigma and discrimination towards persons who use drugs. And by providing safer drug supply, safe consumption sites, and also moving towards the societal discussion on decriminalization is sort of really important. And so I think, Canadians should be seized with this particular crisis, which can actually happen to anyone and could also have increased risks right now for people who may be isolating at home. So there's a lot of tools also that provinces and territories are trying to promote, which reduces the risk of severe outcomes in those who may be more isolated at this moment in time in Canada. So I think all hands on deck. A lot of work needs to be done. Thank you.
Thank you, Doctor. Operator, next question, please.
Thank you. Merci. La prochaine question est de Micheline Laflamme de Radio-Canada. À vous la parole.
Oui, bonjour. On a vu que l'Australie est en train d'évaluer la nécessité de rendre obligatoire le vaccin contre la COVID. Alors, Dr. Tam ou Dr. New, et même peut-être une réponse de la ministre, mais d'abord à vous, Dr. Tam ou Dr. New, quelle serait votre recommandation au gouvernement si on développait un vaccin efficace et disponible au Canada? Est-ce que, selon vous, à échéance, est-ce qu'on devrait est-ce que ça devrait être obligatoire?
Should it be mandatory to be vaccinated?
C'est Dr. New, peut-être je peux commencer et peut-être la ministre ou Dr. Tam peut ajouter. C'est peut-être je corriger quelque chose vraiment au début. C'était jamais obligatoire au Canada pour recevoir n'importe quel vaccin. On encourage, on fait des efforts pour l'éducation, on sensibilise les parents, toute la population. C'est quoi les bénéfices pour recevoir les vaccins, surtout pour les enfants. Mais c'est jamais quelque chose d'obligatoire. C'est sûr, dans quelques provinces, il y a aussi des règlements pour au moins démontrer, comme dit, l'évidence de l'enfant a eu une vaccination ou peut-être si on ne voulait pas une vaccination, peut-être montrer comme pourquoi on cherche une exemption pour peut-être une raison philosophique. Mais c'est toujours notre but, notre objectif pour vraiment montrer c'est quoi les bénéfices de vaccination. Parce que parmi nous autres dans le monde, le domaine de santé publique, on sait déjà c'est un des moyens les plus efficaces pour protéger la population, pour diminuer le taux d'incidence pour toute une gamme des maladies infectieuses. Donc, si on trouve, on espère tout le monde, un vaccin contre la COVID-19, ça va être dans notre suite des outils, un autre vaccin. Et c'est sûr, on va utiliser les mêmes moyens pour encourager, pour sensibiliser, pour donner l'information importante pour les parents et tout le monde, pour peut-être leur préoccupation pour un vaccin. Je pense que oui, on parle peut-être un peu de la réticence contre la vaccination. C'est un enjeu actuel. Même pour les autres vaccinations, je pense que c'est le même défi si on trouve un vaccin contre le COVID-19. Donc, notre approche en général contre la réticence pour la COVID-19, ça va être dans le même genre de nos efforts contre la réticence en général contre la vaccination. Merci.
Micheline, en suivi?
Follow-up question?
Oui, certainement.
Yes,
Madame Hajdu n'avait pas rien à ajouter là-dessus.
Madame Hajdu, don't you have anything to add?
Oui, je suis d'accord avec Dr. New. En Canada, nous avons utilisé l'éducation
et
avis pour les Canadiens dans le bénéfice de vaccination.
Educate Canadians on the advantages of vaccinations.
Et la même chose pour les vaccins pour COVID-19.
It's the same thing for COVID vaccine.
D'accord. Merci beaucoup. Ma deuxième question, c'est vous avez, ministre Hajdu, vous avez indiqué que vous voulez envoyer des messages aux jeunes par les médias sociaux, essayer de les rejoindre pour les inciter à peut-être être plus prudents. On a vu une recrudescence des cas. Il y a un décès d'un jeune homme de 19 ans à Montréal. Alors, je ne sais pas si vous pouvez élaborer ou ça peut être Dr. New, ou vous pouvez le dire en anglais aussi, là, Madame Hajdu, si vous êtes plus confortable. Mais qu'est-ce que vous voulez faire? Comment allez-vous le faire?
Could you please tell us?
Pourquoi le faire et passer par les médias sociaux? Là, donner un peu plus de détails à ce sujet-là.
Could you please give us more details about that? Thank you.
La première chose, je suis très désolée pour la famille de le jeune Canadien qui
about the young Canadian
who have died recently from COVID-19. Pour les gens canadiens c'est un difficile time pour les gens canadiens.
This is a difficult
Comme
time
j'ai
for young
dit dans mon discours, c'est difficile pour les gens canadiens de rester dans l'intérieur et rester chez vous. It's very difficult for young people in their 20s and 30s to give up socialization. It's normal to want to go out and to spend time with their friends and to get to know new people and to learn more about themselves. These are all normal behaviors. It's also normal for them to resist messages that imply that they may also be at risk of COVID-19, because in fact many of the messages early on indicate, and the science indicates, that they are less at risk of actually dying from COVID-19, although we can see from the tragic situation in Montreal that it does happen to young people as well. It's important that we understand the language of youth, and it's very hard for people my age, and certainly even the wonderful communications people that we work with, to understand exactly how to speak with youth and where they're listening. But that's why we're making such a concerted effort to work with a variety of different communicators and advertising agencies that have expertise reaching youth in non-traditional media markets. Young people spend an inordinate amount of time online. They are social media consumers. They are communicating on channels that sometimes adults aren't using as frequently, or certainly different social media channels. And as we evolve our communications, we continually turn our mind to how best to reach Canadians of all different kinds, using appropriate messaging and appropriate channels that will have the best chance of reaching them.
C'est Dr. New. Peut-être je peux ajouter quelques mots en français.
Dr. New here.
Je suis complètement d'accord avec la ministre Hajdu. C'est vraiment, je pense, que pour nous autres, un défi maintenant, parce qu'on voit qu'est-ce qui se passe actuellement avec la proportion des jeunes qui sont atteints avec la COVID-19. Et c'est sûr que l'incidence des conséquences graves, c'est moins élevé parmi les jeunes comparé aux autres groupes d'âge comme les personnes plus âgées, mais quand même, on a vu, il y a aussi de temps en temps un événement grave, et je veux aussi ajouter mes sympathies et condoléances à la famille de jeunes Canadiens qui est mort. Mais aussi pour dire que on sait que les moyens de communication, c'est très important, mais aussi c'est la personne qui fournit les messages. Donc, je pense que c'est pas peut-être les jeunes qui regardent toujours les nouvelles à la télévision, ou aussi même qui lisent les journaux. Je communiquais beaucoup avec mes enfants, qui sont des jeunes adultes de 20 ans. C'est papa, on regarde pas les nouvelles, c'est toujours sur les réseaux sociaux. On partage l'information, donc on sait que c'est YouTube, TikTok, Snapchat, toutes les plateformes comme ça, il faut utiliser pour communiquer avec les jeunes. Et aussi, on a besoin des expertises, des spécialistes dans les communications des risques, et aussi, je ne sais pas en français, je pense que les sciences de comportement, en anglais, behavioral science, parce que c'est pas seulement des vieux comme moi qui peuvent fournir les messages, on a besoin des autres jeunes pour parler aux jeunes, leur propre, comme dire, des population, au lieu des parents, des vieux qui te donnent des messages que les jeunes, je sais, ne vont pas écouter. Donc, je pense que c'est un défi, mais on est en train, à l'échelle du gouvernement fédéral, mais aussi, je suis sûr aussi à l'échelle des provinces et territoires, d'engager à utiliser toutes les expertises, et on est en train de commencer, même nous autres, à l'échelle fédérale, d'avoir des YouTube vidéos et aussi des jeunes pour faire partie de nos efforts contre le COVID-19. Merci.
Merci, docteur. Patrice, on va prendre une dernière question au téléphone avant de se tourner vers la salle.
Thank you. The next question is from Dylan Robertson from Winnipeg Free Press. Please go ahead.
Hi, Dr. Tam. We're seeing some cases on the rise in rural areas of the prairies. Some people are surprised because people aren't clustered in tight quarters like they are in cities. Is this something that you've looked at with the medical officers?
Yes, thank you for the question. Absolutely. We have very regular exchanges with medical officers. And it's true that there are communities out in the rural areas who are now impacted by COVID-19. A lot of the work is really to work with the leadership in those communities to increase knowledge and why certain public health measures need to be followed. In addition to, of course, as I've said, a sort of public health or medical response, responding to COVID-19 is quite complex. You actually have to understand the community, the culture, and be able to leverage the on-the-ground leadership to get buy-in and trust in order for a lot of the public health measures to work. So I believe some of the communities and sort of coming on board in terms of testing. And so you're seeing more cases partly because there's definitely increase in cases and activity in those areas, but also because people are now getting the importance of testing as well. So I think that there's some progress in that direction. But the virus can affect any area of Canada, I think is the bottom line.
Dylan, follow-up?
And thank you. And just to go a bit further, I'm wondering how much of a factor social determinants might be with rural health. At the start, we had communities that were Indigenous where we knew there was cramped housing. There were some Hajdu colonies where distancing was a challenge, but we're starting to see spread in rural communities outside of that context. I'm wondering if there's any factors we should be looking at, like just medical issues in general.
Yes, I think this pandemic has made very obvious the impact of some of the social determinants of health and poorer outcomes. I think much as we want more information and data, it's pretty obvious, even from the information that we have, is that people who have lower income, who maybe not as well supported in access to care or access to supportive environments, all of that can play a really key role in disproportionate impacts. So I think some of that is playing into this. But I have to echo, I think, Dr. Tom Wong and Minister Miller in saying that many of our First Nations communities, our First Nations, Métis, and Inuit communities have shown incredible resilience for their role in reducing the impact of COVID-19 in their communities, because they know their communities, and they, as long as they're empowered to do what is needed to protect their communities, that can be done, and they've shown that to be the case. But at the same time, a broader look at the other social determinants and not forget other medical conditions and the opioid crisis means that there needs to be a more holistic look at addressing the underpinnings of what negatively impacts health. So that is a very important question, and that together with some of the cultural considerations of how communities come together, some communities live in a very congregate manner as their everyday life, and so having those kinds of changes is a big deal and requires a lot of buy-in.
Thank you. We're now going to go to questions over in the room, starting with David.
Hey, David Thurton from CBC News. I'm very interested in this campaign to target young people. How do you determine success? And how are you going to ensure that the message just doesn't fall flat? And finally, Dr. New and Dr. Tam, are we going to see you on TikTok?
Did you want to start, Minister, and then we'll end with a TikTok?
Sure. Having a bit of a background a long time ago in communications and marketing, success is hard to measure. I mean, typically, marketing agencies can tell you, for example, how many views something has had and how many people have been exposed to the advertisement, and even to a certain degree, if the material is interactive, how many people actually now clicked through, for example, to the website. It doesn't necessarily, though, get at attitudinal change. We do regular polling at the Government of Canada to understand Canadians' understandings of COVID-19 and disaggregate that data to a certain degree. So that may be able to help us. I think the best picture will be infection rates. And, obviously we'll have to do some complex assessment, of which thankfully we have researchers to do this with us on, when the exposure to the marketing was, and and how that corresponds to rates of infection. And ultimately, at the end of the day, that will be the best measurement. But I think we will be keeping an eye on all of those other ways to measure whether or not youth are actually seeing the messaging and also interacting with the messaging, and that will give us an idea. We also use focus groups early on with a variety of different concepts so that we are not completely striking out from the beginning. It's a complex area for sure, working with youth, because of course we know that youth are usually on the cutting edge of cultural changes, and so sometimes what an adult might think is cool or catchy or relevant can be rapidly out of date within weeks, if not months. And so thankfully we have, as I think Dr. New pointed out, young people who are helping to guide this work, which I think is a critical component to the success of any marketing, is understanding the audience in which you're speaking to. And that often starts with having some of those audience members participate in the creation of the material. Dr. Tam or New, did you want to say more?
Yes, so I think, obviously there's a lot of intermediary indicators, including the marketing and the, surveys, etc. But as the Minister said, ultimately, and quite quickly, we can detect cases in different age groups and in different settings. So for sure, that's the sort of key indicator. And also to determine if any further studies need to be done. I do think that as colleges, as schools, as workplaces for young people are opening up, I think public health does have a role to play in, together with other researchers, in really closely monitoring how illness is spread and the behavioral aspects of the spread of that illness. I think to your question, or maybe a challenge in the end, I'm pretty game for all sorts of things. I think if people think I'm the kind of person that they would want to see on TikTok, absolutely. But, I'll also depend on my communications expert colleagues to tell me whether I'm the best person to be on TikTok in order for that to be actually successful. Dancing is probably not something that I would engage in, but, who knows?
I think dancing is pretty healthy.
I'll finish off.
I don't have coordination, but other exercise, yes.
Yeah, just to build on, if you want to get very sort of in terms of the lingo, certainly at the beginning of all this, we did needs assessments and focus group testing, etc., to figure out what are the issues, what's top of mind for the young folks. And of course, in terms of the outcomes, what we call process outcomes, in terms of looking at sort of other changes in behaviors, looking at surveys, other methodology. But at the end of the day, the most important outcome indicators, of course, looking at the actual disease infection rates among young people. So that's in terms of the formal stuff. But in terms of I guess social media and so on. I'm not sure if you're aware. Our communication folks, for whatever reason, they tagged me to do some YouTube videos. This was back the day in April, so I did I think 3 or 4 of them, and apparently quite successful. If you look at them now, they're a bit dated. Obviously, what the answers whatever I said on the interviews were with what we knew at the time. So I hope people will remember that and not look at them now and say, "Wow, how come Dr. New said that back, whatever in April?" It doesn't make sense now. But as Dr. Tam said, I'm certainly game if our communication experts believe that whoever it is, if it's Dr. Tam, myself, or anyone else, might be the best person to maybe go on TikTok or some other social media platform. Both of us are game. Thanks.
Following up, David?
Yeah, I was struck by your comments at the beginning of the press conference, urging Canadians to not neglect, their health and, go to the dentist, go to the doctor if you've neglected that. Is that new? Is that something that you guys, is this the first time you're announcing that? And is there something that you're seeing either in data or anecdotally within the health system that is telling you that perhaps Canadians aren't getting their vaccines or, they're not getting their teeth cleaned or whatever?
Yes, it's something that we actually have been trying to message on over quite a period of time now, but it's never too much to re-emphasize that. I think with, I actually pulled together a group of health professional groups and associations, family physicians, obstetricians, gynecologists, and pediatricians, and the colleges, and they have asked us to maybe raise awareness that from where they are sitting and where they're seeing things happening, virtual care has been a really great addition in terms of advancements, but there are appointments that you actually do have to keep in terms of physical appointments as well. And so that's what I'm sort of hearing from the front lines of practice. And other data would suggest that people coming for even diagnosis of diabetes have come down. Now that would be very unusual, because diabetes rates we would expect to be the same or sometimes maybe even exacerbated by the current context. But so you would expect that not to come down. And if there are people are experiencing ill health, they do need to access the healthcare service, whether it be with their outpatient clinics or with the emergency room. So don't neglect the other symptoms that you may be experiencing. And so the other aspect is that as hospitals have increased their routine surgeries and other things, clinics and outpatients are also trying to message that come for your routine pap smears or other screenings, because now is also a good time. In the winter period, there may be other things escalating and other illnesses. So as much as they can keep up with scheduling those appointments, that's a really important thing to do.
Yeah, and Dr. New, maybe just add to what Dr. Tam said. I think certainly, as we all know, during the winter, healthcare services, everything had to be diverted. The priority was COVID-19, and a lot of routine care for other diseases was put to the wayside. And I think for many people, I think they might still be scared, or they may not realize all of the measures put in place, by physicians, dentists, other healthcare professionals to ensure their safety. Of course, I think there's a new role now, and I think that it's something important moving forward in terms of virtual visits and so on. But there's still obviously a place for sort of face-to-face, and I think people just need to be reassured that all the measures are put in place. For myself, just an example, my routine dental appointment was canceled just on the eve when all these things were stopped, and I didn't, get my routine teeth cleaning, etc. And then finally, when I got a call, and dentists had sort of, obviously put all the new measures in place, and they said, hey, we want to reschedule your dental appointment you missed like 4 months ago. I go, oh yeah, okay. And I thought, okay, it'd be interesting to actually see what was put in place, and I was very impressed. And I think it's the same for the dentists as it is for a lot of healthcare professionals. The measures you put in place, the staggering of patients, the environmental cleaning, what they're doing in terms of the face masking when you're going in, how you actually interact with the healthcare professionals and so on. So I think the bottom line message is, hey folks, go out there, all the things they might have sort of put to the wayside beforehand. I think you really need to pay attention to all the other aspects of your health.
Merci. Prochaine question dans la salle. Lina?
Next question in the room.
Moi? OK. Excusez, je pensais que ce serait à elle. Last week when we were here, the numbers you gave on transmission for youth, there was a peak beginning of July, but now it was as much as the rest of age groups. So I don't quite understand why now you want to do a messaging for youth when actually the transmission in that group seems to just be the same as the rest of the age groups?
Well, I can start. It's not to say that we haven't been communicating to youth. In fact, we had some very effective videos circulating some time ago with young people talking about getting ill, both in French and English, actual testimonials from Canadian youth that had become ill with COVID-19 and the impact it had on them and their families. I think it's a recognition that this is an age population that we have seen growth in terms of infections. Oftentimes, it can drive growth in other age categories. And the message does need to continually evolve as we head into a next stage of COVID-19. In terms of where we see youth infection rates going, I'll turn to Dr. Tam to speak about that, or Dr. Nguyen.
Yeah, so I think you're referring to the presentation that we did before, and you can follow the rates on our website, and where, of course, in the initial wave of the pandemic, there was a massive impact on seniors. And then we saw this uptick in the summer months as places opened up. Right now, we're seeing a downward slope. But I think, as I've said, this is a bit of a marathon. This virus is living with us for some time. And I think ongoing messaging, because of fatigue and other things, is actually really important. And I think looking at fresh ideas and improving the way that we communicate with different groups in our population is important. I also know that, as we get into the fall season, we're preparing for that as well. And maybe some of the colleges and other spaces will reopen as well. So this is a really opportune moment to increase our messaging and reach to youth. Just to add that, you can also look at the data, as I said, that I think we have about 10,000 cases right now cumulatively in people under the age of 20. And for the most part, there's very few hospitalizations and ICU admissions, but there are definitely some. They're much less than you would see in the older age populations. But if that number increases, you're going to get more. Even a rare occurrence, you're going to get more frequency. So this unfortunate story and the passing away of a 19-year-old is a reminder that if we don't keep the rates in this population as low as possible, even rare serious outcomes could occur. Also to add that, as we at the beginning talked about schools going back, again, time to engage youth that are, maybe adolescents are in that age group as well. And they can do a lot. They are a very powerful voice, and they transmit things through social media faster than any of us. And again, in kids, we will learn more and more about, the full spectrum of clinical impact as we go along. But right now, they tend to have a milder illness, but rarely. For example, we talked about the multi-system inflammatory syndrome in children. And those are some of the things that we want to make sure parents and youth are aware that some serious outcomes can occur as well.
And on death rates, I was wondering if you have any numbers, if there's been any change in Canada on the death rates of people with COVID, not the general death rate. Has there been any changes from the onset of this in March to now, or has it been constant?
Again, if you access our website, you'll see the curve in terms of the reported deaths in Canada, and there's been a dramatic reduction in deaths from the peak as a result of the first wave.
But I mean in percentage of people getting sick. I don't mean how many people died. I see those numbers. My question is about the rate. How many people this sickness is killing? Has it changed or has it been constant? You understand what I mean? The percentage?
Yeah, so as the number of people in older age groups have declined, the rate of case fatality, if you like, has come down compared to what they were before.
Dernière question dans la salle.
Rachel Haynes here from CTV National News. My question is also about this 19-year-old who had died in Quebec. Minister Hajdu, you expressed some condolences mostly in French, so I wouldn't mind if you're able to repeat that in English as well. But my question is a lot about what more needs to be done across this country to curb this. You're talking about the messaging to youth, but what about any policies that the provinces need to enact, or what changes need to be done to curb this before school starts?
Well, I'm happy to say my condolences in English. Listen, the loss of a child is a tragedy that it's hard to find words for how much suffering that family must be going through right now. And my heart is with them. As a parent of young people, I can tell you this is one of the most tragic events a family has to go through. So certainly I'm thinking of them today. In terms of what more has to be done besides messaging, I think provinces and territories have been taking appropriate actions all along to reduce and prevent the spread of COVID-19. And they are things that are specific to the epidemiology in their own particular jurisdictions. And some of them are large things and some of them are smaller things. For example, many jurisdictions now at municipal levels have masking rules around wearing masks when people are in indoor spaces. There are restrictions on how bars and restaurants can operate, including, for example, limiting people from standing around at a bar and having to be seated to be served. Many jurisdictions have regulations or bylaws around cleaning or around, keeping track of who's in a particular establishment at a particular time. And then, of course, there's all the work that happens at the provincial level as well. And I think it all combines to providing a suite of actions that governments can take. But let's be clear, governments can only do so much. Citizens also have a role to play in preventing the spread of COVID-19. And the things that citizens can do are the things that we've been talking about from the very beginning. It is really about making sure that we wash our hands and that we, that we stay home when we're sick and that we cover our cough, and that if we're at all feeling ill or symptomatic, that we take it seriously, that we reach out and see if it's appropriate to get testing in our particular jurisdiction, that we download the COVID Alert app if we're in a province or territory that has that app now, and more coming on board every day, that we use all the tools that the governments have been working on to collectively at all levels to help citizens protect their health. And the biggest thing is to, avoid crowded, contained, closed spaces. This is going to be increasingly more difficult in the fall. I live in Northern Ontario. The nights are getting cooler already, whereas we might be able to sit on the deck until 10 or 11 at night and socialize in fresh air at appropriately physically distanced spaces apart from each other. That becomes more difficult the colder it gets. So it really will require all of us focusing in on those behaviors that will protect ourselves and protect our families. And, governments certainly can help limiting the sizes of gatherings, for example, for weddings and for funerals, and governments are doing that. But at the end of the day, we also need the full participation of every Canadian in order to keep these rates of infection low.
And just going back on that with the messaging that you're trying to get out to youth, but is there not a mixed message when older youth who are of drinking age, they can go to bars, you can go to restaurants, you can have indoor gatherings of up to 50 people in some provinces, you can have outdoor gatherings of up to 100 people in this province. So how can you tell youth you have to avoid these types of gatherings when they are allowed?
I'll start, and then perhaps the doctors can jump in. It certainly, first of all, I believe, and our government believes in harm reduction. I think if you close down bars and restaurants, in fact, and we've seen this in other jurisdictions, drive underground gatherings that can be even less controlled and less safe for people. So it's appropriate to have access to restaurants and bars and even small gatherings that are done in ways that actually can maximize the protection of people's health. Not to do so can create some pretty underground behavior that can actually be even more dangerous for people, as obviously there's not going to be the same kind of rigor that there might be in a bar or restaurant around cleaning, for example, or screening, for example. In terms of mixed messages to youth, I think to all Canadians, we all have to assess our own individual risk and comfort level for every setting. So, for example, if I'm invited to a large gathering and I'm not comfortable going to that gathering based on what I know about the gathering and how many people are going to be there, I can make that a risk assessment myself. We now have a risk assessment tool for Canadians that's available on our coronavirus website that will help Canadians assess the relative risk of a variety of different everyday activities. And that is really, I think, an important component of living with COVID, is that we all have different circumstances. I am a particularly healthy individual. I don't have any underlying conditions that I know about. It may make me more comfortable with some level of risk that another person might not be. And so I think as we move into the stage of living with COVID, all of these tools together provide the foundation to really keep our infection rate low and to protect the health of Canadians. But it is not one perfect solution. It is a variety of different mechanisms and tools across the board that will help youth navigate this complicated space.
Yeah, I'll just add that there are some sort of underlying fundamental principles about physical distancing, wearing masks, hand washing that applies to any setting. I think so understanding that sort of dissonance in someone's brain, I think, is actually very important. But even gatherings, whether it's in a restaurant or pub, there are actual public health guidance, advice, and even, I think, at the local level, some policies that all those establishments are supposed to follow. And I think we are adapting to those. But then what about the social spaces? And so helping to translate that concept into the social space is very important. Even in gatherings of, say, 100 people, the concept from public health is that it's not about all 100 people getting close to each other. You're still meant to physically distance, wear masks, do all of those things, and only be next to someone who's in your actual social small social contact bubble, if you like. So I think those concepts need to be better communicated. In different settings, there are different rules. Like if you're sitting down in a theater, type setting, there can be spacing that is done. You have to follow those rules in order to keep that physical distance and modify your behavior. So then try to translate that to your backyard. I mean, it's still the same principles, but then how do you message that? Is there sort of visual cues that people can use, or ways in which that message can be enforced, I think is very important. As the Minister said, in my discussion with Chief Medical Officers, one of the quick things that people might think of is, why don't you just close down bars and restaurants? But if we are learning to adapt to how to keep the virus level low while still trying to normalize spaces and give people jobs, and many young people actually work at those settings. But we then, if we see outbreaks, we adapt, we change how that setup is done so that we can live with COVID-19 as we're going along. And of course, if they see that things are not under control at the local level, the idea is a very targeted sort of approach to closing some of these spaces down as much as possible. But I think the point that you brought up is very valid, is how do you translate those public health guidance into, someone's basement and backyard.
Yeah, Dr. Maybe just to reinforce exactly what Minister Hajdu and Dr. Tam have said. So I think in terms of, public spaces, private spaces, I think at the end of the day, it's a matter of risk management and risk tolerance, both in terms from a government or sort of what we can do in the public versus what people do in their individual social bubbles. So of course you could put regulations in, etc. But then what happens when people go into their private spaces and how do they actually manage? So I think it all comes down to risk tolerance. And I've used the same example the minister had mentioned that, bars and restaurants are open. And I think by and large are doing a great job in terms of, all of the good measures, the environmental cleaning, the spacing of tables, how they actually have clientele come in. But at the end of the day, it might be up to myself. Would I be comfortable going to a certain establishment? I might take a look and might say, maybe I'm more comfortable just staying at home and having a beer at home versus going into a bar. But that's my choice, and I can't make that choice for anyone else. The other part also is that I would say, as Dr. Tam has mentioned, is that we can't close down bars and restaurants and say they're to blame. Because certainly from what I've seen, maybe it's anecdotal, as I said, they've done a great job, I think, overall, and even in public events in terms of the measures put in place when they can be controlled by people who actually organize those events, in terms of the public health measures put in place to minimize the risk as much as possible of transmission. I think what we're trying to emphasize, because it seems to be an ongoing issue and challenge, is what people do in their private spaces, those private parties in the homes. There's no one's going to be checking what the social distancing policy is, the use of alcohol, the use of masks, whatever. And of course, all those people gathering in a private space, how comfortable are all the people in that private space sort of knowing about each other's social bubbles and who's been in contact with who, etc. So that, I think, is still the issue we need to manage rather than just focusing on the public spaces. Thank you.
Merci beaucoup. C'est ce qui me fait la conférence de presse d'aujourd'hui.
That brings today's press conference to an end.
Merci.